Go.
All right, guys, are you ready? Tuesdays with Taylor is back, episode number 4. So today we're going to talk about acute ankle sprains. So if you've missed the first 3 episodes, either check out our previous Facebook posts or go on YouTube and check them out. We talked about plantar fasciitis, we talked about headaches, we talked about all sorts of good stuff. But today is acute ankle sprains. So ankle sprains for a very long time, even when I was in high school and going through sports, it basically meant that you need to sit out, crutches, sometimes even a boot. Now the most recent research actually tells us that in absence of acute injury or fractures or full thickness tears in our ligaments, we actually want to weight bear as fast as possible, which means that we're not going to put people in an ankle brace right away, and we're not usually going to crutch them, we're not going to put a walking boot on them, etc., because we actually want the weight on those tissues to help them heal. So most commonly, right, an ankle sprain is an inversion ankle sprain, which basically means that you fall like this, right? We've all probably done it a little bit, some more severe, some less, right? So normally the tissue that gets damaged is called the ATFL. So it's a ligament that attaches right here in this area, if you can actually see it up here on our big board, right? So the ATFL ligament, that's usually the ligament that gets strained. Okay, so in the absence of a full thickness tear, which can really only be diagnosed with imaging, it usually doesn't need surgery, it doesn't need immobilization, it doesn't need things like that. So usually what we do actually is we get these people weight bearing right away. We get them up on their feet, walking, weight bearing, and then finding directions that help relieve the symptoms. Okay, so no longer do we need to R.I.C.E these types of things, which stands for rest, ice, compression, elevation. In reality, we actually don't even want to ice these because we want the inflammation in the area. So we do a lot of really cool things in the office that can really help these things. Dry needling is an amazing tool to help get blood flow to the area and to kind of help start to regenerate those ligaments and those tendons that we've strained. And then also things like laser, things like DNS, the things that we do here in this office can really get things back. So one of my favorite cases was a high school athlete that we had that was getting ready to play in the state tournament in basketball. She basically twisted her ankle in the sectional finals on a Friday. She had to play by Wednesday. It was blown up, as we've all seen it, right? It's black and blue and swollen and stuff like that. By using dry needling and laser tape, kinesiology tape, we were able to get her to play on Wednesday. Now, obviously, if there's legit damage to the ankle, sometimes we need imaging, sometimes we do need a rest, but in the majority of the time, we actually want to start weight bearing and doing things. So I don't have any special tips for you today, other than if you do twist your ankle and it blows up, right, it's black and blue, feels terrible, it hurts to weight bear, come in and see us. We would love to kind of give you an assessment and see if, number 1, do you need imaging? More than likely you don't. And then number 2, what can we do to kind of get things sped up so that you can get back to your life or back to your sport if you're an athlete. So again, if you or anybody you know sprains an ankle, we would love to kind of take care of them and see if we can get them back on the field or doing what they love to do. So stay tuned next week for more Tuesdays with Taylor, and have a great day.